Hello, everyone. We're just getting started. Tonight, I'm very excited to be featuring my fertility doctor, baby doctor, Ray Romero. Here we go. Hold on, everyone. Welcome, welcome. Hi, Sonali. Okay, here we go. Hi, everyone. Hi, Sandra. Okay, hello.
Okay, we're both.
Turn that down. Here he is. Just turning down the volume a little bit.
Okay. Or it's mine.
Perfect. Dr. Romero, can you hear me?
Yeah, sure.
Okay, we're rolling. Everyone that's jumping on, hi everyone. Hi, Tiffany. So thank you for joining us tonight. I'm so excited to be hosting an amazing, very, very special person that has recently come into my life, Dr. Ray Romero. He's lives in Cancun, and he's my baby doctor, fertility specialist, OBGYN, and just an incredible human being. So here he is, Dr. Ray Romero.
Thank you, Rael.
Thank
you for the presentation. Well, you know, it's a pleasure. I love what I do. I love the fertility issues. I love OBGYN, and well, in your case, you are a special patient.
Well, thank you. No, thank you so much. It's just been incredible, and I think tonight you're going to share so much value. You know, for a lot of women that have been reaching out to me, that was what initiated me actually saying, could we do this? There's so many questions, and there's a lot of unknown, and there seems to be a lot of conflicting information. So that was really what I was wanting, because I feel so blessed that I found you and that I have you all to myself. So I want to share, I want to share with everyone else, but everyone that's jumping on, thank you for joining. I know some of you reached out, and oh, we've got a bit of a maybe volume. Perfect. Yeah. I know some of you are overseas. If everyone could just let us know where you're from, say hi. We would love to know where you're joining us from tonight. I saw Sonali right away. I know you're in England. That's amazing, because it's midnight in England.
Thank you to England.
Yay! Amazing. Yes, London, fantastic. Frida, hi Frida. Hi Sue. Oh, amazing. Wow, great, great, great. So good. Hi Angie, thank you for joining us. Amazing. Veracruz, Mexico. Amazing.
Wow. This is where I born.
Viva Mexico.
Also Veracruz.
Yes, we'll have a cheers. We'll have a toast to that with our waters. Oh, hey. Canada, amazing. Ontario, that's awesome. Well, thank you for joining us. So let's dive in, because I want both of us to be able to share this with you tonight. I think if we could start with, for the people that are listening, the women particularly that are really, they're really trying to conceive, they're having difficulty. Of course, like, I mean, Dr. Romero, you told me this, there's so many different factors. This is not like an easy topic at all. But if we could discuss some of the best ways to increase fertility for women and men. And I know that this could be an endless topic, but there's got to be that top sort of 3 to 4 things that jump right away at you. What would you say those things would be?
Okay, well, for fertility issues, normally there are many things or many factors that in some cases can avoid a good fertilization, sperm, egg, okay? Talking about first women, there are many issues, like first the age, then some mechanical factors like some leiomyoma, some fibroids, some polyps, depending of the ovary, the ovaries are working as well as we think the person is. Well, there are many factors. The tubes also for many factors also is a very important factor. So in this case, fertility issues came from both men and women. And talking, well, in this case about women directly, age is a very important issue about infertility. Healthy woman, obviously, okay, it came like, you think like exercise maybe could be not as important as you think, but really we have a big example with you, okay? You are 42 years old, I think, right?
Almost, yes.
Almost, okay. And in the first attempt that we tried to do this fertility treatment, just with your own eggs and with own sperm with your partner Marcelo. So since the first attempt, we could get the pregnancy. So obviously, healthy woman is a very, well, can improve too much. I don't know how to explain too much the conception. Okay?
Right.
So,
Because there is evidence that I mean, please tell me if I'm wrong, but that indicates that if your body mass index is in a healthy zone, that you are more likely to conceive versus someone who's struggling with obesity. Is that true? If you're overweight and just struggling?
obviously, normally there is a syndrome called PCOS, polycystic ovarian syndrome.
Right.
That is normally an entity for obesity persons, obesity people. So in this case, obviously, infertility issues came more like 40% of obesity person, you can get PCOS, and with PCOS, you can get a big percentage of infertility. So obviously, healthy woman in this case, not obesity or obesity person, have more infertility issues with obesity, obviously.
Wow. Okay. Very good to know. So healthy lifestyle increases that likelihood of being able to conceive. Wonderful. And we mentioned like the difference between women and men. I think, I mean, I'll speak for women because I know we all feel this way where it's like, it's my fault, or I'm going to put the blame on myself, or my age, you know, my health, my uterus, you know, whatever, my placenta, where you start blaming yourself for all these things. But as I learned from you, and I had no idea, your partner's aspect of fertility is actually, like, obviously it's 50%, right? Of the, like, it takes,
obviously, normally now is 45% of each. I mean, men and women.
okay, there you go. Wow. I had no idea. And you had obviously run tests, like when we came in to see you. For those of you listening, my pregnancy was a natural pregnancy, but Dr. Romero assisted the pregnancy. But we do have eggs frozen as well for IVF that we didn't end up using. But before we came to see him, after I retired from professional athletics, I competed in Las Vegas, and I came in to see him like a month later, and I said, okay, we came in together. We said, we're ready to do this. And he ran tests on my partner, Marcelo, as well as me, you know, and that was really interesting to me because I wasn't really considering that. So looking at sperm morphology, motility, like the health of actually my partner as well. So that's just fascinating, because maybe it's not us at all, right? Maybe it's actually our partner's health.
Obviously, normally in the first appointment of an fertility treatment, for a fertility treatment, the first thing that you have to do is to, well, do the interview to both man and woman, in this case, you and Marcelo, and first you have to see how you are working. I mean, how the ovaries are working. I mean, by ultrasound, I have to check your age. I have to check by ultrasound if your uterus is normal, if there is no like any polyp, any fibroid, if your teeth are okay. So this is the first thing that we have to do. Obviously, also for your partner, we have to know that if the sperm are okay, I mean concentration, motility, morphology, fragmentation. If everything is okay, so we have a big possibility, a big chance of achieve our purpose, our goal, that is get a healthy pregnancy.
Wow.
In this case, if we see that there is something missing, or there is something that um, can avoid our our goal of get pregnancy, so we have to get a treatment for that. I mean, PCOS, get a treatment with diet, exercise, or some medication. Or if it's the case of a polyp, a fibroid, so we have to retrieve this tumor. Or in the case of your partner, so we have to treat him with some medication also. Obviously, exercise, not smoke, not alcohol, having a good life, I mean, no stress, sleep well. All these can improve the chances of get pregnancy.
Wow.
I want to do to say that normally a person with normal factors. I mean, men with normal sperm count, woman with normal ovarian and normal uterus. Well, it's healthy. You only have the 20% of get pregnant. I mean, no issues in a man, no issues in a woman, so only you have 20%. So you are in this statistic, Ryan. In the 20% of person that the first attempt get pregnancy. So,
Wow.
you're well,
Oh my
you're
God.
blessed.
That is a no. That's a blessing. Absolutely. I've been I've been tapping into that every single day because I know it's completely a miracle. You know, with especially considering my age as well and my partner's age. We're both in our early 40s. So, but speaking of the statistics, what are the real statistics on age and fertility, and has what you've seen clinically, your experiences as a practitioner, supported the evidence? Because I know you're just incredible at what you do, and also the clinic that you are a part of, like everything is extremely advanced. But I feel like the statistics are incredibly depressing and they're really scary, like you just said. And also if we discuss and we look at with IVF as well, because understanding the real statistics with that. But if we look at age and fertility and we look at the statistics as you get older,
Yeah.
what are those statistics?
Okay. Well, first, I want to take this topic first with the statistics of each treatment. First, natural way, you as I told you, is like 20%. Obviously, having a healthy woman with no issues, a healthy man with no issues, so you have only 20%. After that, there is another treatment called insemination. So with that, obviously, you have to remove everything that is avoiding. So with that treatment, you have 40% of get pregnant, okay? If you try 1, 2, or 3, so the percentage is increasing to 40 to 45 until 50%. So you have only you're in the middle of the percentage of get pregnant with insemination. With the IVF treatment, so you increase the possibilities to 60 to 65% of get pregnancy. Obviously, as I told you, with healthy woman, healthy men. So talking in this case, natural way of get pregnancy is 20%. A factor, a really good factor for infertility is age. The ovary is ascending infertility since you get the first bleeding at the age of 9 to 12. Okay, so the ovarian reserve, the ovarian is increasing in fertility until the age of 35. When you get 35, ovary is like standing in the same way, not increasing. And when you get 38 years old, the ovarian is coming down. So this is the first great and big issue to infertility, the age. So that's why I really absolutely supportive your case because well, physically you are a young woman. Talking about ovary, your ovary is not as young as someone of 25 years old. So I get surprised that in your case, you only have 20% and taking off this part of age, maybe you only had like the 15% or the 10% of get pregnancy. So I think the healthy life is like getting the balance of the age, and at the end they get at the same point. So you get, I don't know if I'm explaining myself correctly.
Yes.
So the ovarian reserve for your age uh, get improved at the end because of your health, I think.
Right, right. And
So,
that's something you feel, because I know looking at data and then looking at clinical experience, like your own experiences personally as a practitioner, I wondered if there was any discrepancy there, if like what you're seeing, you know, this is the data, this is the evidence, which obviously it's scary for women that are aging and that biological clock is like tick, tick, tick. But when you say there's actually a lot of factors you can control, like being healthy and just living that lifestyle, like have you seen, I know I'm an example of that, like my age wouldn't indicate obviously that the probability of me conceiving would have been high, but we did it right away, right out of, you know, right immediately. So do you feel clinically you've seen some different things than statistics, or do you feel the statistics are really quite accurate?
no, really, normally statistics in medicine, in scientific things, are where we are based on
Okay.
statistics, because so we take like any kind of person, and of any kind of person we have or we get the percentage of this treatment, or we get the complication of this treatment. So at the end we make the average and we say, okay, in this case, person with normal fertility, no issues, only have by natural way like the 20%. So they are really like really accurate. So that's why normally in person uh, up to 38 years old, I really try to be honest, and I really try to tell to my patients that well, we have in normal person with no issues 20%. Imagine in this case if you have like more than 38, the possibility is decreasing. Obviously, because also the eggs are getting like a bad condition.
The
Okay,
quality, right.
the quality eggs is like decreasing obviously also. So in first time you are not producing enough eggs, and second and very important things, your eggs are like not not in the best quality. Okay,
Okay.
so well,
Some factors to consider. So even a 20, let's say a 27-year-old healthy female, no issues. It's only 20%.
Right.
Oh, wow. Even so age isn't even a factor there. Like it's actually quite difficult to get pregnant.
Yeah, really. Our race, the human being, is a race that are not fertile at all. So compared with some other animals that have many, in this case, dogs. I mean, many puppies, many kitties. We only have one, and we only have a low percentage of get pregnant each month.
Right. Wow, wow, wow. Okay. Well, that's good to know. I think that creates a very real reality. And I mean, I think it's the statistics. I certainly like, I mean, I think when my partner and I came in to see you, we were freezing eggs preventatively, and sure, there's that element of fear. But I think coming into that, we knew that the statistics weren't really very good. But to still remain, like, it just makes, that's why, I mean, we hadn't even tried on our own once, and we came back to see you after freezing eggs because we were like, well, we're not going to waste any time. And I think that's the point is, I think for anyone listening that's feeling like, you know, they're not having any luck and their time is ticking, like, seek help that can really actually give you the results that you need, or the answers to your questions. And I mean, that's going to tie into my next question for you as well. But I think when we came to see you, we felt hopeful, we felt positive, we felt supported, we knew the reality of the statistics, but also that you're an expert. Like, I wasn't going to go to, you know, a gynecologist and just say, we hope to get pregnant, and, you know, I can check my temperature, see if I'm ovulating. Whereas it's science. You know, you said that so many times, and that really resonated with me as, like, to have studied science with nutrition and sports. And you nailed it. Like, this is actually science, everyone, right? Where if you see a specialist that specializes in this is what you do, right? Is you analyze all this data, and it's applied science.
Yeah, normally, first, I love what I do. I love fertility, and second, well, as fertility expert, I can not do like maybe an OBGYN, with all my respect. Maybe an OBGYN could tell you, okay, so go to your house and try to get pregnant and come with me when you are pregnant. So like in this case, because of my expertise in fertility, I cannot do that,
Right.
obviously. As minimum, my minimum is to take you with take you by the hand, like telling you step by step what you have to do first, doing some ultrasounds to see where you is going to ovulate, in which ovary, left, right, to see the follicle, to see the growing, to see the lining, the endometrium, and if it's in a good condition, so we can program the ovulation. We can like do it
Yeah.
in some cases, and telling you the exactly days of ovulation, and the exact days where you can, well, obviously try to get pregnant. So this is the minimum that I can, well, do for you as an fertility expert.
And he says the minimum, but, like, for the women that are listening that feel like they just haven't had a concrete plan with respect to, like, you know, how do I achieve this? I mean, that's like, for those of us that are those type of people, right? Where it's like, what are the steps? You want a clear plan of action here. What are we doing? Like, that's exactly what Dr. Romero did for us. We came in to see him, and he laid it out exactly like that. I'm going to provide you with this. These are the tests we will do. And there was no questions asked. Like, everything was so clearly understood with what the steps are. and from everything, right, to where you did help trigger my ovulation because you wanted to ensure I was ovulating. And then you literally told us, okay, this is what you're going to do. You're going to go home and have a party.
I
And
remember very good.
and Monday, Wednesday, Friday, right? This is the plan. And, you know, you just made it so like tangible for us, where all the uncertainty, all the unknowns were very, very clear. So, I mean, I want to express that because you did an exceptional job of taking all this information, and I'm sure every single woman can relate to me when I say that, like, it's extremely overwhelming, and you do want to feel there's a plan. This is what we're doing. And even I said, if we're not, so if this doesn't happen in like 6 months, then we would go ahead and do IVF. And you said, no, like, this is science. So if this doesn't happen in maybe 3 months, we don't waste time, we do IVF. So you did a brilliant job of, like, and Sonali just commented on the live feed. She said, it's just so much information. And when you don't feel like, you know, like, I mean, I came in with my books and my notes because it's extremely overwhelming. And I think those of us who are people that are achievers, like, we don't fail, we succeed. And it's all about a plan and a focus. And you clearly laid the plan, and the value in that is incredible. And then, of course, you know, we had success. So you're doing an amazing job at.
Thank you. And obviously, I could tell that about all the steps, get your ovulation, trigger your ovulation, program your coitus, all of this because I known before that you were in an excellent condition. I mean, ovaries and sperm. If one of those things were like in not the best condition, so maybe with all my honesty, I could tell you, okay, Royal, maybe this not could work because your ovary is not ovulating, or maybe because the concentration of sperms is not enough, or motility or morphology, I don't know. But in this case, you were like a very good patient first, and second, you were, well, you know where, you are a very both good and excellent healthy person. So that's why maybe we could achieve this objective, this goal.
It's awesome. Yeah, the result quickly. No, thank you. I mean, my Marcelo too, my partner as well, like, his result was, like you said, we were all, both of our results were so healthy that, you know, when you apply the science to it with respect to what you were doing. And of course, we can't forget about love, ladies. We have to still, it can start to feel so mechanical, right? But when you put all that together and you remove the stress of, like, for me, the uncertainty of it all, like, you paved a nice clear path, and you know, the result happened. So I really do hope that that gives people hope. And if you're feeling that you don't have answers, or you don't have a clear plan, you know, I think that you need to connect. Well, you need to connect with Dr. Romero, obviously, but you need to really find, go to a specialist. Don't waste time. You know, don't, you know, if you're seeing an OBGYN and it's like you're not getting where you want to be, and you don't feel that confidence, you're not seeing results. Don't waste time, right? Because look at what you were able to do for us. So no, thank you. That's awesome for sharing. So my next question is, I mean, I think I wanted to really shine some light on the myths surrounding exercise or fitness with conception and pregnancy. I know those are two different things, but certainly I've been very passionate about sharing my journey and just showcasing as much as I can about what I've been doing with respect to staying fit. And obviously when we conceived, I was training even harder. You know, I was in the gym 2 hours a day, training like you know, my normal helmet on like a crazy maniac, and we were able to conceive. I was also very, very lean. You know, I'd just come off competition, and my body fat percentage was actually when I got pregnant, my body fat percentage was in an unmaintainable place. Like that weight I was sitting at was actually not where I can comfortably hold. So I've had so many women say I've been told by my doctor I'm too fit or I'm too lean to actually get pregnant. And then so many women that have also reached out to me during my pregnancy and said, oh my gosh, like, aren't you afraid? Aren't you afraid that you're going to, like, you know, have a problem with your pregnancy because of how you're training? So of course, my perspective, I always say from my point of view, is listen to your body, and whatever you did before you got pregnant, you're probably very safe to continue doing what you were doing. I know we're all unique and different, but our bodies are very resilient. And if we listen to our bodies and we trust our bodies, like I know right away when something doesn't feel good, to stop and just, you know, obviously the intensity has had to go down with training. But when you see a woman that's very lean or very fit or exercises a lot, like a triathlete or someone who's very active, do you feel that they should actually slow down and not exercise?
No, normally since, well, talking about history, since Aristotle, for example, he told in one paragraph of one of his book, he said that persons with obesity has more complication in the birth. So since that moment on history, since Aristotle, so we know that non-healthy person, I mean, not an exercise person, maybe could have like some complication with the birth. So, well, now, by the time, now in the 20s and in the 30s, there was the first person that started to say that exercise in pregnancy could get a better, I mean, a better birth, and during pregnancy to avoid complications since the 20s and the 30s. So by now, I don't know why it still exists some myth about doing exercise during pregnancy. So is now with a scientific base that exercise during pregnancy can avoid, like, first in the baby, no to get a big baby, I mean a macrosome baby, okay? Then for women, some can avoid some chronic disease or disease during pregnancy like preeclampsia, like diabetes, or gestational diabetes, like preterm labor, like some pain, like lumbar pain. Okay, so this is scientific base that exercise during pregnancy can avoid all of those things. So obviously, there is a line that you have to follow. Person with not uh, um, background of exercise, I mean sedentary person before pregnancy, we have to take care of this person because they are not like habituated to doing exercise. So in this case, we have to start doing exercise in a slow progression. Then there is another line of person that they are doing like before pregnancy, moderate exercise. In this case is the same thing. So you have to do exercise as normally you did it before pregnancy. And athlete person, like in your case, Ryan, so you uh, well, in this case, you have, or is, if you desire to do exercise as the same as you were did it before, I mean, a big a competent athletes exercise, so you have to do it. There is no myth, there is no contraindication for do exercise injury rate. Okay.
Wow. Powerful stuff. So we've just, there you go. We've debunked this myth. So exercise contributes to a healthy pregnancy and a healthy baby. And here you have a fertility specialist, the best in the biz, telling you this. So I know, and I absolutely appreciate like when women comment and I'm like, okay, baby, please, you know, and I know everyone's just like, oh my gosh, right? Should you be doing that? But you have to, again, like you said, what is your fitness level? If you are an athlete versus someone who was sedentary, you know, I think that's why it's so great to, like, I know when I take on a new one-on-one coaching client and the goal is for them to get healthy and then potentially conceive, get pregnant, always establishing, right, a ritual of daily activity. It's just such a great, right? And then once they're pregnant, they can keep that going. So
Obviously, I want to tell that in person, we have to individualize every patient because in your case where you were healthy since before get pregnant, so in your pregnancy, well, your pregnancy is going excellent, but in your case, you get at the first weeks, for example, some risk of miscarriage, like getting some bleeding or maybe headache or maybe some issues like some disease. In this case, so we have to be more careful about doing exercise. So, for example, bleeding, in this case, we have to get addressed because of the bleeding, because we don't know if the pregnancy is not getting or is not implanted as well as we think. So there are some conditions that we have to individualize every patient. So with no disease like in the first trimester or in the second or in the third, so we can continue with exercise. So we have to be pretty focused on this. I want to tell, not every person
yeah.
are in condition to do exercise. I mean, try to get the authorization of your OBGYN in this case, because maybe, as I told you, if you are bleeding, if you are getting some headache, if your hypertension is, your pressure is getting increasing like hypertension, so you have to be precaution, be aware of that.
Okay. So individualized basis. Again, just another great reason to, like, if you're mapping a plan out to actually try to have a baby and conceive, that exercise should be considered from a lifestyle standpoint, not only, you know, not only for, right, like you mentioned, reducing body fat percentage or having a healthy body composition, increasing your chances of conception. It helps with, obviously, with fertility, like you said, even if you're aging, but also your baby, like you mentioned, the baby, if you're not fit, if you're not exercising regularly, having a baby that's potentially, you know, over, I don't know what you call that, but overweight, you know, where you have a baby that's, you know, maybe born at 32, 33 weeks and is like 8 or 9 pounds already at that type of term, where you have an unhealthy mom who's maybe not been exercising and establishing, maybe diabetic or all these factors. But I think it's great to talk about, or to, you know, to mention that establishing a healthy lifestyle with food and exercise prior to conception, then those things are going. Because I mean, I will say, as a professional athlete, and I came off, you know, the World Fitness Championships, I was in the best shape of my life. Like when I can finish that competition every year, your body's like a Ferrari. And when I became pregnant, and I was continuing to exercise, your heart rate, that's the first thing. So it's not getting any easier. Like my heart rate, when I started to train, I wouldn't even really be exerting much force. And I'm like, oh my gosh, I can't breathe. My heart rate. So you notice right away that you can't train if you're used to exercising. So imagine for the women that are actually sedentary, like even walking up the stairs, like where you feel like, oh my gosh, I need to stop. Like my heart is pounding. So even for me as a professional athlete that was extremely fit when I conceived, it was the first thing I noticed. It wasn't my strength. It was that heart rate. So your perceived level of exertion has to drop. You know, you cannot, your body will tell you, right? Like, whoa, you need to slow down right now. And you said that too, just watch your heart rate. I was like, oh, I have to watch, like, I can't even actually, I can't actually push that hard. So,
Well, and in your case, I normally tell you the pregnancy get your limitation. I mean, you feel like when you were like in the first trimester, you were capable of doing some kind of exercise, and now you have like, well, because of your big belly, you have like a limitation of doing some exercise. Your pregnancy is getting you like putting you some limitation in some kind of exercise also. So, but well, not to stop. I mean, but I mean, like maybe your pregnancy is putting you like, okay, this exercise is better not to do, or this exercise it's correct because well, there is no limitation on doing that because of your big belly, your uterus.
right, right. Yeah, modification. I mean, obviously the weight, like even when I do my normal cardio now, I've had to really reduce the intensity of that cardio because I'm heavier. So now my weight, you know, it's obviously I'm exerting more force, right? And the calories are higher because I'm heavier. Same with even something as simple as body weight exercises, where I typically always use weight, but now remember, my weight is up 20 pounds or whatever it is, and I've got that watermelon around my waist. So, and Matt, you are training with extra weight. And I think, the modification on our normal exercises is absolutely, like, you can do so much. Every week I've had to kind of change my exercise routine a little bit based on how I've been feeling. So I've never done this before, so I'm just kind of feeling it out. And then when I see you ask me, how are you feeling? Any bleeding? And I'm like, no, like everything feels amazing. And the days I actually get in a good workout, I feel better anyway. So it's
I remember in all your appointments to my room, to my clinic. So I asked you, how do you feel, Royal? Do you have any nausea? Do you have any vomiting? Do you have any colic, any cramp, any bleeding? How is your baby moving? All those things, always your answer is, no, I feel like excellent. So these are the things that normally exercise can avoid.
right.
Vomiting, nausea, cramp pain, lumbar pain, headaches. Also, anxiety and depression can avoid during pregnancy and postpartum. So, well, there are many benefits of doing exercise, but before, obviously, and during pregnancy. Okay?
Amazing. Oh yeah, thank you for sharing all that. So good. The being fit, I have to say, like, I've had a few people, my mom even, last night on FaceTime said to me, and a lot of women have said to me, aren't you having back pain, and aren't you feeling, you must be feeling like horrible now, towards the final stretch. And sure, I have a massage once a week. Tonight is my massage, to help loosen up those muscles, because I also lift. I like to lift my weights. But a strong, fit body, like, I just feel like, I I'm strong enough to actually, like, this hasn't impacted me really physically as I can imagine if I wasn't fit or strong, but I feel like my body is so strong that I can hold her. I can hold her well, and I stretch every single day, and I'm aware of obviously the top, you know, with the lumbar, my lower lumbar is really curved, and just to be aware of that and to be mindful of that, but actually being fit and strong, how much easier it is to carry your baby too, you know, like I can be out 3-4 hours for the day and I'm good. I'm not tired, you know, because I'm strong and I'm fit. So it's also awesome to feel that way.
This is kind of obviously when, for example, when you are not pregnant, a person who do exercise get your muscle like stronger than before, right? So it is your case. It's the same. During pregnancy, you are obviously you are working your muscle, so your muscles are getting stronger for carry your baby, and also for in this case lumbar pain. Your muscle from your back are getting stronger, and your legs are getting stronger. Your arms, well, are your muscles. So that's why maybe you don't feel like something big. You are carrying very good your baby in this case because of the exercise of your muscle. So,
Right.
well, in this case, congratulations, Royal. I don't have I don't have like the I don't know how to say your charm of doing exercise. Well,
For everyone that's watching, when I come in to see Dr. Romero, I'm like, "How's your training going?" And he's like,
yeah,
I'm not sure it's going." So,
yeah.
but
I
no,
will
no.
try, right? I need you to put me on exercise.
You got it. I'm sending you my home fitness program right after this call.
Okay.
But no, amazing. That is so great. I definitely get more questions on the fitness aspect than I do the nutrition aspect. But I don't, before we jump into, I know there's a couple people definitely that had questions tonight. Before we're going to do a live, a Q&A for those of you who are on and wanted to ask questions. But I did want to mention also, obviously nutrition, and it's like that healthy lifestyle that goes hand in hand. And Dr. Romero and I could talk about this forever. But the aspect of, you know, talking about cravings, and women are like, what are your cravings and what are you, and food, and making that an important part of actually nourishing your baby. Like, I think the first thing people think about right away is supplements. Like, what are you taking, you know? And it's like, well, what am I eating? You know, obviously a whole food diet is the number one thing, and then supplements are secondary from obviously the baby, for memory, brain development. We need iron, folic acid, you know, there's all those factors. But nutrition, I wanted to say that from eating well, my whole life I have this foundation, and I really feel like hormonally it's balanced me out to a point where I have no cravings. Like, I really don't have cravings, and I still have my treats once a week, but focusing on eating for wellness and focusing for nourishing my baby. I feel like a lot of the cravings per se that women talk about, like burying themselves in a tub of ice cream every night, stuff like that, a lot of that then triggers hormone imbalances, right? Where you don't have those good healthy fats with respect to hormone levels, and then you're eating a lot of garbage foods like fats and things that aren't, obviously crap foods like trans fats, whatever, that aren't nourishing your baby. But the aspect of nutrition, I just wanted to also point out the importance of those two things sort of going hand in hand. I don't know if there was anything you wanted to add there to that, Dr. Romero.
Okay. Well, this is not only during pregnancy that I want to tell that healthy food should be like the principal, not only in pregnancy, but before pregnancy.
Yeah.
And obviously during pregnancy, healthy life, I mean, all kind of food that you can eat is excellent. Obviously, during pregnancy, you have like a limit of calories that you have to intake in this case, and you have like a limit of kilograms, well, not in pounds, but kilograms that you have to lose or to gain in this case. We have like maybe a limit of 16 kilograms, okay? In your case, maybe you can eat a percentage of, I don't know, maybe 100 or 200 calories because you are doing exercise during the day. But in case of person that uh, are sedentaries and they are not doing exercise during pregnancy, though we have like a limit of kilocalories that they have to intake. So we have to do like a very careful pregnancy, just going with how many calories are you taking, how many exercise are you taking, how many calories are you losing during your exercise, and how many calories are you taking in the day. So we have to move in part of that. How to move, this is how many you have to gain. So you
Yeah.
have to get the role of the game of lose, gain calories during the day.
Right, to figure it all out. I think knowing your actual basal metabolic rate as well, and that's the amount of calories, right, for those of you who are listening and aren't sure, but that actually you burn when you're just at rest, right? Your daily caloric output without exercise, it's actually like not as high, I think, for most of us as you would think. Like for myself, for example, I carry a lot of muscle being the most metabolically active tissue in the body. You would think that my metabolism would be really, really high. And I had it actually tested with metabolic testing when I first got pregnant, just to see where it was at. And it was 1,244 calories and
1200.
44. So I would have expected, and what I've gauged my BMR at, and obviously I had slowed down, training had slowed down, but I mean, I had gauged my BMR somewhere around at least 1444, like at least a couple hundred calories over that. And then I'm trying to also eat the deficit of my exercise. If I exercise 700 calories, I need to eat that. And then I need to also consider the baby, a couple hundred more calories, right, for the baby. So, I mean, before competition, I'm usually eating 2,300 calories because of how I train. So it's interesting when you start to, and this is where having the support, right, having nutrition or having a doctor that understands this can help you, because I think most of us are, it's the world today is overeating, right? Eating too many calories, and people that get pregnant and think, I need to eat more for my baby. It's like, well, you need to eat very little more, like 200 calories more, but we need you eating the good stuff, right? The good stuff.
We have to get the balance. I remember when I was like doing my specialty of OBGYN, normally we were seeing many diabetic person, gestational diabetes, okay? And in this case, we have to carry out very, very exactly how many calories she must take daily because of the diabetes. So this is the same in cases on person that maybe they are not diabetic. So you have to take like a good portion of calories depending on maybe your age, maybe how many exercise do you do, or maybe on how, if you have any chronic disease, I mean diabetes, of if you have some background of diabetes in your parents or in your aunts. So we have to do like a whole history and take carry out how many calories you have to take during the day, taking all those things.
Yeah.
So it's not like, okay, I can see you and you have to take 3,000 calories. No, it's not like that. It's like doing doing a history, obviously, take your backgrounds, take your weight before pregnancy, take your weight during pregnancy, and we have to look like how many pounds, kilograms are you taking, are you gaining during pregnancy. If you're gaining maybe too much, or I have to tell you how many calories are you take by day, and you tell me maybe 3,000, well, I have to tell you, well, this is not your range of calories that you have to take. Maybe you have
Right.
to take less. So, I mean, obviously the OB-GYN is, in this case, pregnancy is a big, a big word. So
Yeah.
there are many things that, in some cases, the OB-GYN is not only the God. Is I'm not like I have to do the whole things. You have to get the aid of some nutritional person. Of in the case of you have some chronic disease, maybe you have to get the aid of some specialty on I don't know, hypertension endocrinologist. So the OB-GYN is not like the one. You have to have a big group,
Right.
a multidisciplinary a team where you can have a psychologist and a nutriologist and self-coach maybe, and internal medicine internist. Well, all those things for getting a good and a healthy pregnancy.
And get involved.
It's not,
Uh,
yeah, yeah.
it's I think a lot of women are, it's like the weight gain, right? And the oh my God, you have to gain all this weight, or women gaining 40, 50, 60 pounds from a pregnancy. And I know obviously if there's diabetes involved and there's other factors involved, but this is where knowledge is power. Like, ladies, if that's your case, and you shouldn't be thinking about calories during your pregnancy that shouldn't be a stress, right? Whereas if you know your intake, and even if you've consulted and you have a meal plan that meets your caloric intake on an exercise day versus a non-exercise day, and you have that knowledge, it's knowledge is power. Because we all do tend to eat. It's our world, right, where we are all tending to overeat. So it's great. I don't think that your pregnancy has to be this complete disaster where you have 50 pounds to lose after your baby. I mean, if you have a healthy pregnancy and you have a really good grasp of food and exercise and lifestyle, these things can be, doesn't have to be like that. So no, it's great. Thank you for sharing. I know we're almost at 7 o'clock here, so I wanted to jump into some questions. If anyone that's on right now had questions, please ask away. We're here, and Dr. Romero is just like this amazing source of wisdom. So jump on. I had a question from Enigma Healing, and she's in the UK. She's on very late tonight. She was asking, we are going for an embryo transfer, and we have 5 viable embryos. What can I do to prepare my body for a successful procedure?
Okay, well, first, talking about the main topic of this, that is healthy life. This is the one principal or main issue that you have to take in count. But after that, taking in count like exactly uterus and ovaries, okay, with your fertility specialist, well, he has to tell you about the preparation, the endometrial preparation, like take some estradiol, some progesterone before the transfer. Okay, this is the main thing that you have to get prepared first. But well, before that, maybe I used to tell to my patients to take some folic acid that is obviously is before and during pregnancy. So get some vitamins, prenatals, vitamin D, antioxidants like resveratrol, okay? it's a good option. The resveratrol is scientific proof that can avoid, or in this case, retrieve any kind of endometriosis in a level, in a mild level, okay? And vitamins, folic acid, vitamin D, vitamin C, resveratrol, antioxidant. In some cases, vitamin E can increase the lining, the endometrium. So there are many things that, in your case, you can take into account of those vitamins.
Wow. Okay. Okay. Um, what about CoQ10 with respect to an IVF procedure? Does that help at all, or?
Yeah, obviously coquinone, and in some cases, DHEA in poor responders. I mean, with fatigue ovary that are not producing enough eggs. DHEA, coquinone, and testosterone also. This is talking about the mechanism of producing eggs.
Okay, for egg production. And
Yeah.
then for the transfer, all the other factors that you mentioned, that was a lot. Sonali, did you get all that? That was a lot.
Normally I used to.
Okay, she's saying, yes, she says so much involved, but thank you very much. So, okay, great. Amazing. And I know someone else had asked a question as well about new research. Nina, I got your question. I'm coming right back to you. New research on acupuncture, increasing the probabilities with IVF treatment, so much so that some fertility clinics actually have in-house acupuncturists now working. And I when someone had asked me that question, I did look up some of the evidence, which was quite promising. What are your thoughts on that?
I, as allopathic medicine, I mean scientific medicine, I am in the way of allopathic things. I mean medications, because they have like scientific background. But I am not broken with some alternative medication or alternative treatment. In this case, acupuncture, I am not at all like fight with this. So in this case, really, I don't have like enough information on how it works, the acupuncture in fertility. But I can tell you that if you are getting the allopathic medicine in conjunction with acupuncture, alternative treatments. So for me, there is no like I am not broke on doing that.
Okay. Okay.
Obviously, taking first your allopathic medication.
Right.
Okay?
Right. And then considering that as an adjunct, if the patient wanted to, you don't have a view on that. Either way, if they wanted to, sure. Okay.
Yeah, there's no problem in doing acupuncture. There are many alternative treatments that normally persons are like joined with. So for me, there is no problem doing another alternative treatment. But obviously, first you have to sweep the allopathic treatment first.
Right. Okay. Thank you for that. Nina, she says, now Nina, I'm not sure if I'm saying this correctly. She says, I was on Minera, MINERA, for about 5 years. Is it possible to struggle getting pregnant right after taking it off? So meaning because she was on that, I'm assuming that's a medication.
Which one?
Minera, Nina, are we saying that correctly? Minera, IUD. Okay. So she's saying she was using an IUD for 5 years, the intrauterine device. Is it possible to struggle getting pregnant right after removing that?
Yeah, normally the IUD in this case is producing some progesterone inside the uterus that normally take your ovaries asleep. I mean, they are not working during the IUD inside the uterus. When you remove the IUD, your ovaries are like in the big percentage of fertility. I mean, the first, the second, the third month after retrieve the IUD is where you have the most possibility of get pregnant. So yeah, well, first remove it with an OBGYN, and obviously I recommend you to try with an fertility specialist to take care of you and take you the guide or step by step all those things that you have to do after the IUD retrieve.
After it comes out. Okay. So Nina, I hope that answered your question. That's good. I had no idea. That's good. Great to know. No, amazing. Did anyone else have any questions? Or we're here to help. But Dr. Romero, how do they find you? You know, those that signed on today, and I know that you don't just see patients that are fortunate enough to live in Cancun like myself, but you also schedule online consultation. How do they find you to connect with you after this?
Okay, thank you. I am involved in social media, so I have Instagram, I have Facebook, also Twitter, and obviously some fun. You can look for me in my pages, Dr. Romero. Well, with
Perfect.
all with pleasure, I can for you. I can ask all your questions if you have some doubts, and if you want to do some video conference before coming here to Cancun, with pleasure, really.
Amazing. Okay. No, that's great news. So you can just connect with him that easily, everyone, just on Instagram, even just send him a message, and then he can get that scheduled for you and help you with your family goals and your goal of being a mom or being a dad. So no, Dr. Romero, thank you so much for joining me tonight and sharing your wisdom with everyone. It's what an absolute privilege to have you on, and there's so much knowledge. Your passion, your energy for what you do, it's just contagious. So thank you so much for joining us tonight. So valuable. Everyone's saying thank you. So we appreciate it, and I certainly appreciate you. This has been a beautiful journey for me, pregnancy for me, and you've just been a massive part of that. And I know Marcelo and I are very, very fortunate, and we appreciate you so much. So thank you.
Thank you to you, Rael, for inviting me to your Instagram, to your famous Instagram. And with all my pleasure and with honest, I can help you in any kind of fertility issues or any kind of OBGYN issues with pleasure. And maybe, sorry if my English is not as a native American, but well, I hope you had understood all what I say.
It was perfect. I know we don't want to hear my Spanish. So so thank you for speaking English with us tonight.
Thank you very much, Rael, and well, see you soon, I think.
See you in a few more weeks, 33 weeks and counting here. So yeah. Thank you, Dr. Romero, so much, and we'll see you soon.
Yeah, of course. See you soon, Rael. Thank you to all.
Bye, everyone. Thank you for joining us. Bye.